focus in on Part A on Medicare, explain to you exactly who CMS is, what Part A covers, the gaps in Part A, and how to fill those gaps. The Center for Medicare and Medicaid Services, we refer to that with the acronym being the Centers for Medicare and Medicaid Services. So CMS is a government-run program that has authority over the administration of the health insurance entitlement program when you reach age 65. And you qualify if you have turned age 65, and the coverage starts the first of the month that you turn age 65. So if you turn age 65 on the 25th, it's retroactive back to day one. You can't be turned down for supplement policy during what we call the guaranteed issue period. And you also become eligible if you have been disabled for 2 years or if you're diagnosed with renal care. Also a caveat of the guaranteed issue period, that is 3 months before your month that you turn age 65, that month during, and 3 months after is your guaranteed issue period. Medicare government plan does have 4 parts. You have Part A, B, C, and D. What we're going to do is we're going to focus in on Part A today. The focus on Part A being most of the individuals have paid 40 quarters into FICA. You look at that on your paycheck. If you're self-employed, you usually pay that tax yourself. If you're a W-2 employee, your employer's paying it and you're paying it too. If you just moved to the United States and you haven't received 40 quarters of FICA work, then you're going to have to pay 100% for your Part A. Now the average cost is about $441. If you work less than 39 quarters, it can be substantially more if you haven't worked any quarters. Part A, what does it cover? Well, let's take a look at the in-hospital approved cost by CMA. And that's important because approved by CMA is critical. If it's not approved by CMA, it's not going to get paid by anyone. Part A pays all in-hospital amounts above $1,184 for the first 60 days. So that's your deductible, your first 60 days. We're going to be looking at the gap areas here, which are highlighted in this color. All amounts above the daily deductible after day 61 and 90. So what that means is you pay the first $296. Medicare pays 100% after that. When you hit day 91, then your deductible goes to $592 a day up to day 150. And then 0 amounts are paid beyond day 150. Now Part A pays for the blood after you paid for the first 3 pints. Part A pays 100% of the home health care services and 80% for durable medical equipment approved by CMS again. Part A is 100% day 1 through 20, and then in day 21 you pay $148 a day for the nursing facility up to day 100. So these are the areas that are a little bit weak, or the gaps. And the reason that we're giving this seminar is to let you know what your options are to fill these different gaps. So let's take a look at a claim right here. And assuming that you had open heart surgery and it cost $50,000 when you got the EOB, or the explanation of benefits, and $25,000 was from the hospital. So that would fall under Part A. The other $25,000 would be the surgeon's fees, which is $25,000 too. So we have them split out for simplicity. All right, what happens here is if you only were in the hospital for 7 days, then what you do is you pay the deductible $1,184, and then Medicare picks up the rest of the amount that's approved by Medicare. The Part B, just give you a little example of what it covers. You have the $147 deductible, plus you pay 20% of the remaining bill. So what that means is you pay $147 deductible, then 20% of the remaining $25,000 is $4,971. You can see this is where you really get hurt. So you have a total amount exposure here of $5,118. So when you add the Part A deductible in plus the Part B cost, you have a total out-of-pocket expense to you that Medicare doesn't pay of $6,302. So let's take a total look at your gaps under Part A. You've seen under Part B it can bite you pretty bad. Now if you have a long stay in the hospital, you can get bit too, because these are the areas that aren't covered, $1,184, and then you go through day 60, Medicare's paying this amount here, but as soon as you hit day 61, the $296 a day deductible starts. And it goes all the way through day 90, so we're looking at $8,880 here in exposure. And then if you get to day 91, you go to $592 a day deductible at $60. So you got $35,000 exposure here. So let's take a look at the total here. If you are in the hospital, if you get out in 150 days, you've got an exposure of about $45,584. Anything past that, you pay 100% yourself. So here's some more additional areas that we have gaps. The skilled nursing facility, as you can see, the first 20 days it's paid at 100%, and then you go into this daily deductible of $148. So you got 80 days exposure here, which is a pretty good gap too. Now after 100 days, you're on your own here. Additional Part A gaps, the blood, you pay 100% of the blood, Medicare pays the rest of it after the first 3 pints. And then hospice care. Hospice care is when you're sent home and you don't have long to live, and the people come out and they take care of you until you pass on. Now that's approved 100% of what Medicare approves. It's paid by them. If you have respite care, what respite care is if your normal provider has to take some time off, the additional person comes in, there is a 5% liability that you have there. All right, so the Medicare and Medigap plan, well, the Medicare and Medigap plans are offered by private insurance companies, and what CMS did is they standardized the policy that can be offered to the public. And the Medicare or the Medigap policy, the options are also signified by letters. This does make it a little more confusing to the individual because you have Part A, B, C, and D that's offered by the government, and then they standardize these plans and they say, okay, you have A, B, C, D, F, G, L, M, N, and they change these periodically. You can see some of the letters are missing. There used to be options there. As the needs change, so do the plans. Option A, everyone has to offer that. This is the only option that's available for disability. Option F and G are the 2 most popular. The only difference between F and G is the Part B deductible. Sometimes it's in your best interest to buy G if you save enough money. You look at the deductible and see if the premium warrants that. N used to be guaranteed issue. It's not so popular anymore. Some of the companies don't offer it anymore. But I always recommend F and G to my clients. It's your choice, you know, which one you choose, but you should have at least have option A. One of the reasons option A is a little higher because all your disability people are in that trust. So let's take a look at filling the gaps. What do these Medigap policies do, or Medicare policies do? Well, the in-hospital, the gaps that are filled. All right, so Part F pays this deductible. Part F pays this deductible. Part F pays this deductible. So does G. So then what happens is you have coverage for 1 entire year with a Medigap policy. You can see that after day 150, the Medigap policy takes you out to a year. These are some pretty important gaps that really do need to be filled. Okay, so option F, let's take a look at the skilled nursing facility. The Part A gaps, you can see the 100% here by Medicare, and what the Part F does, or the Medigap policy does right here, is it pays a $148 deductible. So you've got 100% coverage all the way up to day 100, but after day 100 you are on your own whether you have a Medigap policy or not. All right, so option F, filling the gaps of the blood. It does pay 100% of the first 3 pints. It goes ahead and it takes care of the hospice care. And filling some more gaps, at-home health care. Medicare pays 100% of the approved services that are medically necessary. The durable medical equipment is paid, the $147 deductible, and then the 20%, because this kind of falls under Part B too. At home recovery services, you pay 100%. And then foreign travel, Part F does cover foreign travel. It is limited. And that's the end of Part A. I hope this seminar has been helpful to you, and please watch our other seminars.